joining me today as well. A lot to go over. Busy day in central New York, and as we certainly have a new chapter in front of us with the virus, but at the same time, the grim reality is the virus is here and still impacting us every day, and we've lost two neighbors since yesterday. One was a Caucasian woman in her 80s, and the other was a Caucasian man in his 80s. We've now lost 58 individuals who have been in hospitals, and we have lost 26 individuals in our community that have lived in nursing homes and passed away in nursing homes. Total number of COVID-19 related deaths, 84. Again, we want to think about these two individuals, their families, as we grieve for them. We grieve for everybody who we've lost related to COVID-19 and everybody that we've lost in this process. We haven't been able to grieve as families, as a community at large, for our loved ones, just because this virus doesn't let us get together the way that we once did. Not sure if we'll have that number every day. We will be doing proactive testing every day moving forward, hunting for the virus. We now have 1,523 positive cases since March 16th, 35 new cases since yesterday, and we have 19,171 negative results. We sent 1,516 tests from Onondaga County since yesterday. Once again, into next week as well. Today, and I know the mayor was there earlier, our mobile testing location at our WIC parking lot, the old No James Market on Gifford Street, was up and running, really focused in on many of the Syracuse Housing Authority buildings and some of the neighborhood there, testing from 11 to 7. We'll do this mobile testing in communities where we really want to try to hunt down the virus, protect our vulnerable, but also if we just haven't gotten a lot of information from the communities. Is there hidden pockets there? We'll be in rural communities, we'll be in suburban communities as well as other city neighborhoods. When we look at our regional testing data, let's see what this says. I have not seen this yet, so I will be reading this off, but I'm pretty sure it's going to be good. Let's see here. Oh yeah, that's good. So we, again, 775 a day on average, 7-day average. That's what we needed to get to 7 out of 7. We got there yesterday, reflected in the governor's presentation today. We had a huge testing day as a region yesterday. We thought we'd fall between 1,000 and 2,000, and it looks like we did just that. 1,800 tests were done yesterday with all of our partners. Cortland County, again, I want to thank our partners in Cortland County, Chairman Hyder. Cayuga County is doing a big day today. We didn't have numbers from yesterday, but they have a big day today with Chairwoman McNabb Coleman, Madison County Chairman Becker, and Oswego County Chairman Weatherup, and of course Mayor Walsh is here as well, and thank him for all of his support from our regional team. But you can see the numbers, huge day. When you look at our average now, we're over 1,000, 1,048 on our 7-day average. Very good numbers. Hospitalizations up 3, more than yesterday, representing 9% of our active cases. That percentage has held true to form for the last few weeks, around 8-9%. We now have 16 individuals who are critical, up 1 from yesterday, 2% of our active cases. Again, the number goes up a little bit as we have more active cases, but the percentages are holding true to form. Out of the 56 in the hospital, we have 43 Caucasian, 11 African Americans, 4 of another race, and 1 individual who has not shared their demographic data with us. To date, we now have had 181 people released from the hospitals, up 3 from yesterday. When we look at our overall data now, 1,523 positive cases since this process started. That's up 35. Pretty solid day when you consider 1,200 tests came back. The percentages there are very good. We're presently monitoring 659 active cases, up 12 from yesterday. We have 785 people who have now recovered. That's up 21 from yesterday. That's a very good number. 10 individuals in our positive case total, our household contacts, of previously confirmed cases. If you heard the governor earlier, he mentioned that statewide they're seeing that and talked about that we've been seeing that for a period of time. It's very difficult in some of these properties to properly isolate, especially if you have a head of household situation. And so, unfortunately, we know that families will get this if one person gets it. Now, on the positive side, these are individuals who are already in an isolation situation. They're in a quarantine already, so that the risk to the rest of the community is limited. 6 of our new cases are affiliated with senior living facilities. That number's down quite a bit from yesterday. The day before yesterday, the number was pretty solid too. Again, the risk of these cases is limited to the rest of the community. Why we are disappointed when we see these cases, though, is we know that our residents in these buildings are going to have a very hard time coping with the virus, and that's what's driving a lot of our mortality numbers. That leaves 19 cases of community spread. So our 6-day average is about 14 for community spread. Again, solid numbers, certainly numbers that are sustainable, and we're going to be watching those closely moving forward. We expect the community spread numbers to move up next week as we get back together. That's why we need to continue to be diligent with our physical distancing. It's critical at this point. We now have 1,688 people in isolation or quarantine. This number is higher. It's going to stay a little bit higher because CDC guidelines have changed related to if you showed 7 days of getting better, no symptoms, no temperature for 3 days, you could then be qualified for a recovery. You're out of isolation. Just recently, that changed from 7 days to 10 days if you are not a senior citizen. If you're a senior, it's 14 days minimum. So, again, our active cases are going to stay larger, longer than what they were in the beginning of this process. Just something that, as we learn more about the virus, the guidelines change. We find better ways to do business, and we pivot. Out of the cases, 892 have been female, 631 have been male, 49 under 19, 243 in their 20s, 187 in their 30s, 194 in their 40s, 230 in their 50s, 204 in their 60s, 167 in their 70s, 159 in their 80s, 90 in their 90s. Breakdown by age, percentage-wise, 19% under 30, 31% under 40, 44% under 50, 59% under 60, 41% over 60. Breakdown by municipality, again, a lot of this is being driven by specific buildings. 801 total cases in the city of Syracuse, 352 recoveries, 120 cases in the town of Onondaga, 31 recoveries. Town of Clay, 119 cases, 86 recoveries. Town of Geddes, 84 cases, 23 recoveries. Town of Manlius, 64 cases, 51 recoveries. Town of DeWitt, 63 cases, 46 recoveries. Town of Salina, 63 cases, 46 recoveries. Town of Cicero, 55 cases, 33 recoveries. Town of Camillus, 47 cases, 33 recoveries. Lysander, 30 cases, 26 recoveries. Pompey, 24 cases, 21 recoveries. Skaneateles, 15 cases, 14 recoveries. Van Buren, 15 cases, 4 recoveries. Marcellus, 6 cases, 4 recoveries. Atisco, 5 cases, 4 recoveries. Lafayette, 4 cases, 3 recoveries. The towns of Elbridge, Fabius, Spafford, and Tully, all 2 cases and 2 recoveries. Certainly, as we get into restart, we just need to be more diligent than we have before. Again, this is a step forward in this process, but the risk is a little bit greater now. It's a balance that we have to learn how to live with, but we need to continue to take it seriously. I'm going to let the mayor talk a little bit about restart as well, but just a couple things that we learned over the last really 24 hours. One, everyone has agreed that the central region is ready to start tomorrow for the phase 1 businesses, that there are now a process for you to essentially certify your business, whether you've been operating today or you will be operating on Friday. Step one, you need to view the summary guidance for your business, and the website is posted on forward, forward.ny.gov/industries -reopening-phase. That is a mouthful. We'll have to figure out a better way to communicate this. The mayor's very good at this. We'll get his input on this. But once you go to the web page, you need to review the guidance for your business. You need to read and affirm detailed guidance for your business. And then you need to fill out the business reopening safety plan template. The safety plan must be kept at your business and made available in the event of an inspection. The inspection would come from the county government. You need to submit your plan. You do not need to submit your plan that you have to any state or local agency. So if you're a Phase 1 business, you need to go to the website, affirm, attest, fill out the plan, the template, keep the template at your business. In the event a county health inspector or an inspector comes to your business to make sure you're wearing the proper protocol, your PPE, then you show the plan, and that's how that process will work. Our regional group is meeting and continuing to have calls and guidance. We'll have more information on different businesses and what phases they'll go into. It looks like there might be a little bit more discretion given to the local regions for future phases. So that's something that we will communicate with. At this point, I want to bring up Mayor Walsh to the podium for some comments as well. Mayor?
Thanks, County Executive. The best I can do right now is just to Google New York Forward reopening, and I think you'll probably get to the right spot. But we'll make sure we share that URL with everyone. Really, I just wanted to come and reinforce some of the messages that you've heard today from Governor Cuomo and County Executive McMahon. The reason we are in the position we are to open Phase 1 tomorrow is because collectively we've been doing the right thing. We've been in alignment among our leadership in the community. The community themselves have stepped up and have done the right thing. And what's critically important is, again, understanding that the reason we got here is because we have been doing the right things. And if we want to continue to make progress, we need to continue to do the right things. So now is not the time to let our guard down. Now is the time to be more resolved because, as the county executive said, we are introducing some new risk here. And this is all about risk mitigation. So we need to make sure that everyone continues to do everything they can to mitigate that risk. For the businesses that are within Phase 1, again, the information that they need is on the website. One question that we've received, that we just received an answer from the state, is businesses that have been operating as essential still need to certify themselves through this process. So that's important. Every business in every phase needs to self-certify and affirm that they are doing all that's required of them, and we do have the ability to follow up and to make sure that those businesses are complying. We continue to get questions on other businesses, other industries. Again, we are meeting now on a daily basis with our regional control group. We continue to get a lot of questions about churches, mosques, temples. How do people worship together again? It came up in the governor's briefing today, and that's still something that we're working through. It is not clearly identified through the phases. We've discussed it now on each of our regional control room calls, and we'll continue to get people guidance. But as the governor said today, ultimately, if you're talking about large gatherings, we know that is the most dangerous place for the virus to spread. Whether you're in an agricultural facility, a meatpacking plant, or a church, large groups of people together is dangerous. It's a risk, and we have to mitigate that wherever possible. So we will continue to try to get everyone information. As you've seen, the testing continues to increase. We encourage people to go and get tested. I visited this Syracuse Community Health Center site yesterday, and the site over at WIC at the old No James on the west side today. Both were busy. Both were operating very efficiently. I want to credit the employees at the Community Health Center, at Nescentia, everyone involved in those processes, that they are working well. People are taking advantage of the opportunity, and I encourage people to continue to. Lastly, I just want to acknowledge and thank County Executive McMahon for his continued leadership. We wouldn't be here as a region without his leadership, not only through the restart process, but specifically recently with the testing. What has occurred over the past few days was a Herculean task, and the county executive and his team led the charge, and I want to thank you, County Executive, for that. I want to thank Governor Cuomo. He has been with us every step of the way. His team has been very communicative, have answered our questions, and as we enter into this new phase, I think the fact that we were all together for that announcement speaks to the alignment that we have in local and state government around this important process. And finally, I want to thank the community. None of us would be here if you all weren't doing the right thing. So I just want to reiterate my call not to let your guard down, to continue to focus on maintaining healthy practices, protecting yourselves, and protecting each other. Thank you.
Thank you, Mayor. Couple numbers, and we'll take questions. Again, right now, if you're symptomatic and you have questions about whether to get a test or not, anyone can get a test at the Syracuse Community Health Center right now, but if you want to call the Upstate Triage Hotline, 315-464-3979, someone will walk through your symptoms with you. Think about telemedicine. Our seniors are healthcare workers and adult nutrition hotline. Again, if you find yourself in need of a stopgap type service, you need a meal, you need groceries, you have a need, and you just need help, please call 315-218-1987. We will do our best to help you with whatever you are facing. Child Care Solutions, our daycare program through the month of May. We'll talk more about this moving forward, about expanding this as more people go to work and kids are out of school, but we do have daycare slots available at this time, 315-446-1220. And certainly for many, today will be a nice day for mental health, sign of progress, kind of trying to get back to life the way that it was once known, but the mental health crisis that we're going to face from what has happened to us and the shock value of that is real, and it will continue to be real. Please contact 211. Get yourself some social, emotional support if you need it. They can make referrals and help you. There's no shame in that. Questions for myself and the mayor?
Ryan, while you're on the subject of hotline numbers, is there a centralized number or place where businesses can go with questions for the regional control room about what they're doing?
Yeah, we'll have a number tomorrow that we will give forward where businesses can call, ask questions, and then we can find and get them the answers. So we'll be unveiling that tomorrow.
It took longer than you'd like, and you knew it was coming when the governor today gave the 7th criteria a green mark. Mentally for you, what did that mean to see it there? Green is a good color. It was there. We can reopen tomorrow.
It was a good mental health moment for me, the mayor, I'm sure, for my team, who, to the mayor's point, when you look at when we understood the testing strategy moving forward, there was conflicting information on what you needed. Capacity-wise, capacity for testing meant, do you have enough test kits to do 775 a day? The answer we're saying, of course we do. We have the capacity. We qualify. When you had to then have that into a rolling average, when we understood that last week, we knew you weren't going to be able to get there by rushing things through on a Mother's Day weekend. You had to set up a strategy for the Monday, Tuesday, Wednesday. Many things were already scheduled for independent living facilities. So my team did this, and our partners executed, and they did a very good job. And our team in Onondaga County, our numbers were just tremendous. It helped. It helped to restart. It helped a lot of people who needed the peace of mind that they don't have COVID-19, because they could then go. And now that infrastructure is in place, we've helped some of our other counties get infrastructure in place so now they can do more proactive testing. And again, this process, this virus has forced us all to work together in a different way. And now we've done it, and we've done it together, and we've accomplished something that is meaningful. So that will make us stronger for the next challenge going into the next phase. So it was a good mental health day today for me, Andrew. Certainly if I got there, we were all in the room together, and there wasn't green there, you might have seen a mental health breakdown. But that didn't happen, so we're happy about that.
Do you have any information yet on how many local businesses have attested to their adherence to the plan and will be opening tomorrow?
I don't. We have our regional control calls later today, so hopefully we're going to, the mayor and I both like data, so that's very important data. How are we going to have that shared with us so we can kind of track that in real time? And because everything now, we're all trying to take information from economic activity moving forward to try to assess in real time, not just this now, but from the economic recovery side. I've made a lot of friends with auto dealers. It's our #1 sales. I call them and I email them and I inbox them on Twitter asking them how many cars they sold today. And we're trying to look at any indicator we can to predict what the damage is on the other side of this virus. So on the control room, we have the Director of State Operations, Kelly Cummings, and then I know him as Mayor Driscoll, but if you know him through the state, it's probably Director Driscoll is on there too. Then Mayor Walsh, myself, and the leaders out of the other counties. And then 2 members from the Regional Economic Development Council, Randy Wolkin and Anne-Marie Tallarico from Labor. So it's a good, if you look at the counties, we were all, and the mayor, we were all working together on our own restart plan. You've seen much of what we talked about with our own plan has been reflected in what the governor has put forward. You then bring in the Red Sea Board, which is at some point is going to have to work very hard with all the partners on recovery, and then you have a direct tie into the governor's office. So we'll be looking for certainly Director Driscoll to continue to help feed us information from these databases. And when we have questions, there's still some things we need to get clarified, because we know that it sounded like to me related to surgery centers that they can open from the answer today. That's been ambulatory surgery centers and some of the other surgery centers, they're different. So we just got to get some of these other things ironed out when we heard, you know, your eye doctor, your foot doctor, every other doctor that hasn't been deemed essential. It sounded to me like they're okay to go. We got to iron these things out. Yeah, the region is the region. So really part of this pressure point, I think, to maybe what Andrew was getting at earlier was the fact that our region drives all the numbers. So if we have bad numbers in the region, because we're so connected with our populations and our personal behavior, in Madison County, many people come in and work in Onondaga County. That means that if Onondaga County has large community spread, that can expose Madison County and Cayuga and Cortland, et cetera, Oswego. So we're not on an island. We're all connected. So we've been doing the data collection. You've seen the data. You've given the data every day for how many straight days. This is nothing new. It's now bringing in the other counties into the process. And what's changed is how you analyze the data and what, as this process has gone on, there's certain things that used to mean a lot to us that don't mean as much because the guidelines change. So you try to capture data in real time that shows you trends and try to get in front of that. So Certainly, we've talked about it when we saw I don't know how many weeks ago it was, 4 or 5 weeks ago, when we saw our first cases in our senior buildings. We knew at some point, Ellen, that meant our deaths were going to go up.
What's your biggest fear going into phase one?
Yeah, you know, I just think we need to be smart. I think we're going to be smart. And we're going to be together a little bit more now. There's going to be more contact. Just let's not, to the mayor's point, let's not take the success we've had as a community for granted at this point, and let's just do what we've learned and realize that just because we're getting back some, some of the freedoms that we've taken for granted for so long, let's be smart about it so that we don't go backwards and slow down phase two. Phase two, if you want to think about phase one's loosening some things up that we're already doing. Phase two is really a big step moving forward and testing the virus. And the mayor and I can take a walk in downtown and see more people than each other just walking by across the street, right? So that's kind of phase two. To get to phase two, we got to do well in phase one, and we know what we need to do. It's just be smart.
Are you afraid businesses who aren't part of phase one will try to open?
I'm sure some will. We'll deal with it.
I know you said that you were looking for more guidance on how to enforce that yesterday. Did you get that from the state?
I think I heard what I needed to hear from the state. So we'll have a conversation on the local control room. We knew going in, the mayor and the sheriff, and from a law enforcement standpoint, there's certain things, the large gatherings that they have to deal with. But from a regulatory standpoint on the business community, that's something that falls under the county government, under our health department or our new investigative unit that we'll put together.
How do you plan to enforce that?
So we have a couple investigators right now that will do that. We'll have we'll talk internally about a line to call for complaints. I think there is a line right now that you can call the state and complain, and then it filters back through to the locals. But we may want to have our own local line, but certainly we're going to have a local line established or a number established for questions about reopening, probably staffed by economic development officials.
One of the things that I think seemed new today about phase one was for retail, it's not only curbside pickup, but also in-store pickup.
Yep.
How is that going to work?
Well, I think what you'll see is, even if you think about, I've been doing a lot of takeout restaurants. We certainly are doing our share in our household and trying to support the local economy. But when you go in, and many of these restaurants have done a very nice job. They mark and communicate for you where you're supposed to stand while you wait, and then you go up. So a lot of it will be probably the businesses are going to have to be, they've had some time to think about how they're going to make this work, whether it's appointment only for certain things or innovative online. You come in and then you pick it up for purchase. Certainly you'll have furniture stores that will be able to deliver things. They've had time to figure out how their business is going to work, and I think that's what the governor kind of said today is you can't answer every single specific question based off of one set of rules, because they're physically or functionally it's impossible. So we just need to use our best judgment and common sense when you can't answer every set of rules, and that's why we'll be here to give guidance.
So just, hypothetically, if I go online and buy, a pair of sneakers from Dick's, and then I don't know if they'll have in-store pickup or not, but if they do, and I go in and I get them and I don't know, it doesn't look like they fit, or I want to try another size, is that, what's the line there?
Yeah, I think they're gonna have to do that with if you went through a process where you're doing an in-store pickup and something doesn't work. I would assume as long as they can help you through physical distancing, which most of these facilities should be able to do. They're quite large. I think that falls under the common sense category. What you can't have is 50 people coming in and walking in and browsing and trying things on and all these other things that normal retail looks like. We're not there yet. We'll get there, but we're not there yet.
Another kind of specific question. You talked a little bit about specialists, but for dentists, what phase do they fall under for reopening for things that aren't urgent or emergency procedures?
Yeah, so right now, if you have a cavity and your dentist believes that it could turn into a root canal, you should go get it fixed. You shouldn't wait right now. I think part of the challenge, and again, we want to get this right with the State Department of Health on this topic. We've heard from many dental hygienists and others who work in that space. This is a space where we know that the virus can pass through saliva, very dangerous. You need the right PPE. We want to know all the regs that the CDC, that DOH is talking about. So when we're enforcing, because that's something that we would enforce rigorously because of the risk involved, we know that we're enforcing with all the right criteria. So to open right now, you can, if it is a situation that is an emergency situation or can lead to one, it can be addressed as is. But we're trying to get specifically for dentists and some of these other industries. We want the common sense argument for retail goes out the door when you're talking about somebody working with somebody's mouth with saliva, right? So we need to have the proper protocols and guidance from the state on this. So we're going to continue to work and press on that.
Would there be enough capacity to do rapid testing like they do before some surgeries at dental offices?
Right now, rapid testing exists at the 3 hospitals in a limited capacity. So what you could see is there is specific machines that we are trying to get our hands on that can allow you to do thousands of tests a day and get them back within 24 hours. So if you had that machine in the community, you could very easily go into a situation where you could have an appointment on Wednesday for the dentist, you go on the Friday before or Monday before, you get tested, you get a result. Now that there's no 100% risk mitigation here, because you could drive to the dentist and pick this thing up on the way there. That's why the PPE is so important to protect the employee. But everything you could do to avoid risk is something that's what life's going to be like for a while. And so these machines, these larger machines, we're all advocating to try to get these machines in our community, because that will be a big part of what life's like, especially in the fall when we welcome students back to campuses on college, to be able to test all these students as they come back. Very powerful tools.
The governor put worship and religion, it sounded like, in a later phase because of the mass gathering aspect. But could local churches work through the regional control room and pitch to you a phase 2 or phase 3 social distanced in a church or mosque or synagogue service?
I think the mayor and I were just talking about this, and but right now I think it's your gathering of 10 is still kind of what the norm is. Many churches I know exist. They invite 10 parishioners and they get together and they pray, and they do it very safely. Many of these buildings are very large. Is there a way to get to 25, then 50 before you get to some of this? Those are conversations worth having, and I think we're going to have them. We have not yet, Chris. We want to, we're going to talk to State DOH. We want to be consistent and understand if it's a local order that I can implement by myself. I'll probably try that. My executive orders need to get approved by State DOH related to COVID, so we'll probably put forward a fine now that we have the guidance that the businesses are attesting to that they have to perform. We have something to work off of that. So hopefully my law department has something for us to look at for that. Certainly, we're not in the business of going around and fining businesses unless they're doing something egregious. Warnings first, then fines. But some of these businesses have a higher standard to the community because of what they do and the risk that's involved with that. It's going to be a process, Ellen. It's going to be tough, but we're going to do it. Our team has gotten through every phase of this, and we've had people that are adapting to their new job descriptions every part of the process. We never thought that we would have so many contact tracers that are Johns Hopkins graduates now of the contact tracing program. So that's something that new little certification that they can put on their resumes, though. Yeah, we have investigators in our law department. Right now, they're not doing a lot of investigating the way they used to. They're now going to be doing investigations with our health department. Things like that, where you take the resources you have and you move them around a little bit and make it work.
So now we know the process businesses have to follow online. You mentioned trying to get your hands on that information. Do you hope to have a list of businesses in your region that have agreed to the state's guidelines that then you have to enforce? It still seems like if you're the enforcement of this agreed to information that you don't have access to yet, it sounds like there's still kind of a break in the chain.
It's happening quickly, and so we're all dealing with something we've never dealt before. There's no perfect way to get to go. Easy to shut down. You just tell people to shut down. Harder to get going under these new environments. So we understand more than we did yesterday. This is up. I'm sure they're going to share by county. They'll have the ability to filter by county what businesses have attested. So if we get a complaint about a business, we can then go and see what businesses, if they haven't attested right there, there's strike one, right? So you got to go attest. If you're allowed to be in that phase, if you're not allowed to be in that phase, then you got a different problem. So again, from the enforcement side, our law department's working on that now that we've seen the guidelines that businesses have to agree to.
Will that be publicly available so that patrons and employees can know who has certified and what they've certified to?
Yeah, that's good. I would think so. Mayors, we gotta. Yeah.
I did.
Yeah, I think each county is going to certainly have their own. The regional control group doesn't supersede any authority that the governments already have. If the mayor sees something in his city, he has certain powers. I see something in the county, I have certain powers, emergency powers, just like what we shut things down in the beginning. I think what this process, and I'll let the mayor give some thoughts on this too as well. This gives us the ability where we're working together in real time. We're looking at all the data for the whole region. You can make better decisions by communicating with each other and understanding the different perspectives. But certainly if Madison County sees something specific to Madison County, Chairman Becker isn't going to ask Ryan McMahon what to do in his county. And I know he's watching now, and I know he's chuckling as I just said that. So I think from the region, though, if you see a spike in some of the categories that happen, and it's data, and data can be a moment in time. A couple weeks ago, we saw a spike in hospitalization rates because nursing homes were dropping off patients that weren't sick at hospitals because they didn't have capacity to do it. So that type of spike you discussed at the regional control room. What's going on in Madison County? What's going on in Onondaga at this hospital? Why did our hospitalization rates go up? You talk, you realize that it's not a 911 bell. It's a moment in time. Okay, let's track this for the next 2-3 days and then see if it gets back to normal. So I think that's kind of the value of it. Mayor, do you want to add anything? You good? Okay.
We've seen the enforcement of social distancing become much more education-based than criminal-based. Will the enforcement of non-compliant businesses be more aggressive?
Andrew, I don't want to go there right now. I would think that if you do something egregious to put the public health and the health of your employees and your customers at risk, in an egregious fashion where you know better, certainly people's patience. If, same thing now. If Sheriff Conway gets called to a house with 100 people in a party and he says, everybody disband, you know this isn't right. Okay, Sheriff, we're going to disband. And then an hour later, nobody disbanded, and he gets called back again, and he says, are we leaving? Yes, Sheriff, we're leaving. 2 hours later, they don't disband. He comes back. What's he going to do? He's going to enforce it. So I would think I believe that the private sector is innovative. They're responsible. They're going to respond. They're going to be up for the task, and that they're not going to make their local government have to enforce things that we've never had to enforce.
But does a business that opened that isn't allowed to in phase one deserve only a warning?
Maybe they needed a clarification. Once they have that clarification, then certainly we would expect more of them. Yeah, I think the risk is you have more people every day that are. I'm making some assumptions here, Ellen, but for the most part, I'm assuming if you're not working now, you're probably within your home for most of the day. And so now your hours within your house are limited because you're back at work with people that you haven't been really around. You don't know who they've been around. Or you're out doing something, some sort of commerce that you just haven't been doing as much. So there's just more human-to-human contact as you get going with each phase. And with more human-to-human contact, the virus has more opportunities to feed. And so we're getting into the point of the process where this respiratory virus is going to show us quickly if it behaves like other respiratory viruses in the months of June and July and August, or if it's to itself its own entity, and it's going to continue to be very aggressive during those months. So we don't just bringing people back together presents new opportunities, and that's the risk. So even though we're coming back together, there's still enough. We're still smart enough to come back together in a way where we mitigate that risk. I think that's what you're going to hear us continue to talk about.
Do you see yourself treating possible outbreaks in phase one like you've treated possible outbreaks in senior centers? If 5 workers all of a sudden get sick in the same business, you'll then proactive asymptomatic people, you'll try to divide up, get people into quarantine quickly. Is that the same approach?
Yeah, it is. So if we see a trend in a company, and we're not going to let it get to the situation where you need to see 10 or 20 people out of a company. If we see a trend, we're going to test everybody. And so that's something that Dr. Gupta and I have talked about.
Okay. How long? Ooh, sorry.
Could you say a little more about how the regional control group works? Is it just a informal sharing of information, or are you meeting every day and making regular decisions?
Yeah, we've been meeting every day, and our goal was to get to restart. So sharing information and really communicating with the state of New York, okay? Because the state of New York, as much as I talk to somebody and the mayor talks to somebody about what's specific to our county, they've been dealing with New York City, they've been dealing with Long Island, the Hudson Valley, which was an absolute disaster. So they haven't had to worry about Central, and that's a good thing for them. So really communicating with them about what we've been doing, how we are, where we are, and we don't need to recreate the wheel. We just need to expand on it. And so that's what it's been about, giving information about where we are with testing. That was the big thing, right? And so now you're talking about you're at restart. The next big phase in is communication with the private sector, answering the private sector's questions so that your economy can open up safely. And so that's what I anticipate the next 3, 4, 5 days will be like with the group.
But then when it comes to enforcing the rules, as the governor said, it's in the hands of local people. That's really, it depends on whose municipality it is?
Yeah. The regional control group doesn't have its own government enforcement arm. We're just a bunch of government leaders together with some private sector leaders, and our state leaders. So essentially, if the Madison County Health Department has a challenge in Madison County, they're going to be the ones who have to enforce it, just like in Onondaga we would, or Cortland or Cayuga. And then, the mayor's teams had to enforce social distancing throughout this process as well. So, at some point, the regional control room will shift from health data and metrics to phase 1, 2, 3, 4, and then maybe you'll see some sort of blend, for economic recovery. Maybe it takes a new twist.
So at the end of 2 weeks, as a group, you'll probably make a recommendation to the governor's office about entering phase 2?
I would think the data would speak for itself, and as long as the metrics you're hitting today are you're still there or within reason, then that means you go to phase 2. You don't need to go back and do this again, and the data is going to be there every day.
What kind of team are you building in terms of the investigators, and what's the strategy, the mission they'll be tasked with?
Well, I think we are going to take folks that have that experience, whether it's food inspectors or investigators. And again, I'll talk to the DA to see if he has some folks he wants to spare if we need them. And they will be there certainly to follow up on calls that we get from the state. Right now, our law department and the DA, if a complaint comes through the state in our county, it follows through to Bob Durr and Bill Fitzpatrick. And then I'm briefed on it, and then so that process will still be there, but it's more about communication right now, and then certainly we will be very sensitive to professions where there's higher risk for spread of the infection. That's where I see our inspectors really spending the majority of their time.
Okay.
You don't see inspectors out tomorrow?
We will be responding to calls for the first few days. We will not be proactively doing anything. So if there's calls and complaints, certainly, but from a proactive standpoint, we haven't been able to give guidance to the industries we're concerned most about yet.
I have a two-part question.
Yes.
How long will essential businesses that have been open throughout the pandemic have to submit their safety plan paperwork to the state, as you mentioned already? And then also, will the businesses that will be opening tomorrow be required to have it submitted before opening? Because I know they might already have created the plan, but maybe they didn't submit it, or maybe this might be the first time they're hearing about the submission.
Look, there's going to be a little bit of flexibility with that. My suggestion is let's get the paperwork done.
Mm-hmm.
You probably start it today. Let's get it worked through, done tomorrow. Again, this was official news today, so it was, but certainly now we know this should be a priority for everybody. And so let's take the next 24 hours, get our paperwork lined up so you can, with confidence, operate your business knowing you've done everything you're supposed to do.
Thank you.
Mayor.
Just one note I wanted to mention there. Just because businesses are allowed to reopen doesn't mean they necessarily should. Again, as you can tell, a lot of this information is new. We are getting up to speed so we can help educate other businesses. But the county executive and I have talked about how we as employers are going to react and respond to restart. And I think we both feel in certain cases just because we can bring people into offices doesn't mean we will. And I think similarly with businesses, you have to use common sense. You have to do what's in the best interest of your business. And there will certainly be some businesses that will spend all night filling out their plan and getting certified. And then there are others that will likely take their time and work their way through it. These businesses haven't gotten as far as they have by just winging it. So I think I just want to reinforce for businesses going into that do fall into phase 1, and for everyone, that you have to use common sense, be smart, do what's best for you and your business or your individual situation, and reopen in a way that works for you and that most importantly is safe. And so, again, just because they can't open tomorrow doesn't mean they should.
Mayor, just out of curiosity, what will you do at City Hall tomorrow? Will you change anything or bring people back as a result of
There's nothing in phase one that really impacts the way in which we're doing business in city government right now. There's a few things that I'll talk about at my briefing tomorrow at 1 o'clock in terms of certain programming that we may start to introduce, but again, specific to office environments, nothing in phase one directly impacts that. But we're planning as an administration and as a team, again, being cognizant of what the phases dictate, but ultimately prioritizing the health and safety of our employees and efficiency and productivity of our staff.
Mayor, while you were at some of those testing sites, did you get tested or have you been tested at all throughout this process?
I have not been tested. I probably will get tested at some point. I haven't felt symptomatic at all throughout this process, but I've talked about it as a family. We did a little internal family poll in the Walsh household. I won't disclose the results, and I've talked about it with my colleagues as well. No, I just wanted to be on the ground. I wanted to show my appreciation to those that are staffing the sites, and also just to observe with my own eyes how they're operating. And we have had the Syracuse Police Department at both sites managing traffic, and I was pleased to see both sites are operating smoothly.
It sounded like the governor left it up to you guys and the local leaders about some youth activities, playgrounds, camps, swimming lessons, things like that.
I can say for the city, we are still working through those issues as well. We haven't made any final or formal decisions around summer parks programming, pools, for example. How much of that is dictated through the phasing and how much of it is left to local discretion, I think, is still to be determined. But we are operating on parallel paths right now, and just again looking at our own processes, figuring out how we can do everything safely.
Mayor, you're going to start charging for parking again on city streets.
Did that press release go out since I've been out of the office?
It has.
Okay.
On Monday,
Good.
I think.
Good to know.
Just the strategy and that timing.
Yeah, when New York Pause went into effect, we felt that given all of the other challenges that people were having, we thought it was an appropriate time to relieve the additional financial pressure of paying for parking, especially because different people had different circumstances. You had some hourly employees working at essential businesses, and we didn't want to penalize those employees that might need to park on the street. And so we thought that it was an appropriate time to take a pause ourselves, to give everyone a little bit of room to breathe. That was not it was not an insignificant financial consideration. We lost out on probably hundreds of thousands of dollars. But it's also not an easy consideration to reintroduce it because we know that there are a lot of people struggling economically. So like everything else, we're trying to find the right balance between making sure that we can get the resources that we need to deliver our essential services to our constituents while also being cognizant of their own financial challenges.
Ryan, what are some of the industries you mentioned that you're sensitive to that might offer risk, the most risk in phase one?
Healthcare. So we need some clarification on the healthcare. That certainly dentists has been the topic, orthodontists, others. Many of these business owners are saying they can do this safely and they have the PPE and they can do it. Those are situations where we're probably not going to just take everybody by their word. We're probably going to check in on that. Yeah, I don't think we're dipping our toe or jumping in. I think we're strolling, and it's more than you think when you think about that. There's many distribution chains and manufacturing that have been on the sidelines. Construction now, projects that were essential to anybody who wanted the construction done but hasn't been able to happen yet. House remodeling, when you think about home building, you think about all this is all going to begin tomorrow. And so it's a lot of activity, and certainly for the region, I think thousands, if not thousands and thousands, tens of thousands of employees getting back and starting to earn a wage, and that's going to generate, economic activity. But it's going to, there's risk with this, so we got to balance it, and that's what we're doing. We're in a good spot right now going into this. When you look at our data, when we look at it, and we look at the community spread numbers, really our fourth or fifth week in a row of really solid numbers, in a good position with our resources to be able to aggressively track and trace, and nobody can say we aren't testing.
Essential workers know what to do when they're working, how to stay safe. What's your message to the people who've stayed home through this? They're part of phase one, like some construction workers. What's your ask of them tomorrow as they resume their work?
Yeah, hopefully the management has really picked up industry best practices. One of the things that I think, to the mayor's point, I just want to highlight, and because these people email me and they call me, but there are folks who have pre-existing medical conditions that are very scared about going back to work. And these are your employees, and if there's a way for them to stay home and still do their job and accomplish what they do a little bit longer, I would ask that you consider that. And why a little bit longer? Because the more time we have, the more we learn about the virus and the risks to various individuals. So that's something. But I look at manufacturing. There's a lot. There's a toolkit. There's a tool book on how to handle this. McMahon, Randy Wolkin, and Center State CEO have been really putting forward best practices on how business can kind of take that step forward and what the new risks are. How do you mitigate those risks moving forward? So there's been a lot of, and that was part of our process when we put together our restart plan, and part of the Economic Resiliency Task Force, part of what the Red Sea Board's been doing. So here we are. We've gotten to the point where we can restart. Now we need to do it safely and productively. And if we can do that over the next 2 weeks, we'll be talking about phase two, where you'll start to see your downtown start to breathe some new life.
You mentioned that thousands of workers could go back to work in phase one. Do you have a ballpark estimate from Center State or anybody on
Yeah, Tim, I don't. I know that in our call with the state control group, initially, I believe the state budget director had some very good numbers on what each region, how many employees. They've looked at how many employees in each phase by each region, what that means. So I don't have the number off the top of my head. It might be something that we can get, though.
That was Mojica's office?
Mr. Robert Mojica, yep.
Is there anything going to change in county government operations during phase one? We talked about the libraries. I'll talk more tomorrow about specifically what that means. We're assessing right now. I've asked the zoo to give me a restart plan. Certainly, we're looking at parks. Understanding we don't do as much programming as the city does as far as summer programming. That's something we'll assess, but certainly with Dr. Gupta, we're now putting together guidance for many of these summer camps and trying to how you could do it safely, and then where does that fall into the timing of it. So these are all things that we're all thinking about, and we're all working. But county government's going to look at the city, the county right now. We need a lot of help to keep the services we provide whole. And but at the same time, we're going to have to figure out how we do things differently. The Civic Center wasn't built for physical distancing. That's for sure. So we're looking at how we can make strategic changes and how we do things moving forward with the anticipation that the virus will be living with us.
As more people begin to go back to work, what options will they have for childcare? Because I mean that's already so limited just for essential workers right now, and many places have already had to close. Like, is there going to be a way to phase them in, or?
Yeah, look, it's going to be a challenge for some households. We have our Child Care Solutions plan in Onondaga County that has slots available. Having schools be remote and distance learning is helpful for many of the teachers and teachers' assistants, are also parents, so that's helpful. But we're really talking about a gap in time of probably 2 to 3 weeks when you think about Phase 2, you get more of the economy in towards the end of June. Really talking 2 to 3 weeks where normally people would need continuity of care plans themselves with the kids being out of school anyways. So it's not as bad as it would have been if we were doing restart in March. But certainly each community is going to have to think about continuity of care and fill those gaps.
Do you have any update on the inside of the mall?
No, other than the fact that tomorrow, or actually today, we let our executive order expire because we knew this guidance was coming for curbside and in-person pickup. Certainly, we don't want to put other retail at a disadvantage. Certainly, you can't. The mall. You can't have the entertainment and the restaurants open until later phases, and the ownership's going to have to figure out with their tenants on how they could do this. And just because you can do this doesn't mean all those tenants are going to want to open, because if it's hard to get to their business and they don't have any sort of plan, to Tim's point earlier, to drive business, you're not going to bring back the employees to sit there and do nothing. So the mall certainly will be seeing more activity in future phases, but this certainly does give a glimmer of hope for some of those businesses that call that facility home.
Do you view this as your job, or a new part of your job is beginning tomorrow?
Yeah, your focus from building up the infrastructure to meet the guidelines has changed now. Now it's going to be communication and working to communicate with the private sector, answer questions, regulate, deal with the behavior of that, so that, and at the same time tracking the public health metrics, so that we can get to phase 2. And if we do all that well and we get to phase 2, then it's about getting to phase 3. And in the same time, the mayor's job and my job is going to get complicated, because some of the things we normally deal with are going to pop up as the weather changes, and some of the traditional challenges will be there for the governments. And we're looking at looming deficits where we need help from the federal government.
Right now, when someone is sick, the route is very much through their doctor or through the triage center, and then that information gets to the health department. If a manager is aware of an illness within this phase 1 reopening, do they have an outlet to the regional control room to say, hey, I suspect something's not good in my business, I'm here to help and shut things down, but I need your guy? Is there a line to you guys, a line to your team, if it's less medical advice but more, what do I do?
We're all leaders in our own space. I'm an elected official. The mayor is an elected official. We all have constituencies. We get these calls every day. The regional control room does not have there are not 7 people sitting in a room with staff taking calls and plotting policy. We are your officials that come together with communication to the top levels of state government, with the private sector. They're sitting with us, giving us guidance from labor and certainly the private sector for input. So if there's concerns, you communicate with us the same way you would yesterday, today, and moving forward.
I believe 8 weeks ago today is when we moved into this room for your daily briefings. Did you think 8 weeks ago you'd still be at that podium in this similar format?
No, and early on, you know what was interesting? Early on, I think the initial situation in Wuhan was 9 weeks, where they started to see things get to the point where things were manageable. I think we're managing this now. Certainly, there's still a lot of risk, but I think if we're not in our 9th week, we're close. So it's interesting the timetables held true here as well. But we're not. This is part of the process. We're in a fight, and we're going to continue to get knocked down. And we've gotten back up every time. And it's really, we get to stand up here and take some credit, but it's our teams, it's the community at large, it's the healthcare professionals at Upstate, Crouse, and St. Joe's that we got to see some at Upstate, the mayor and I earlier. Everybody's played a role. Our child care workers, our essential businesses, our media. So everybody's played a role to get to today's point in time for the community at large. So we should reflect on that and be proud of that, knowing the job's not done.
Will universal testing continue after tomorrow at the community health center?
Yeah, we're going to get an assessment on where we stand on supply chain. So seeing how our labs are doing, assuming the supply chain's still good. Our turn times from the labs have been good. We haven't seen a backdrop, but we just want to make sure that we are not. The reason we're doing testing in other mobile labs is because we need that information, or we have concerns. We want to do preventative things, so we don't want to lose our supply chain just on blanket asymptomatic testing if we have stress on it. I'm not saying there is stress on it. I don't know the answer to that. So until we green light that for next week, we want to make sure we don't have issues with testing kits and things of that nature.
Potentially tomorrow could be the last day for that. If someone is asymptomatic.
Potentially it could be, or potentially it could not be. So let's. I want that on the record because I know the headline. If I don't do that, so okay. But again, everybody, I want to thank you. I want to thank the mayor for all of his support in this process and his friendship, and thank everybody in the community at large. Everybody should be happy that we're making progress, but we need to still be diligent moving forward. As we still don't know enough about the virus, and as much as every time we take that courageous step forward, let's make sure that we don't have to take a step backward. So please be safe.